This is QD Clinic, stills or not. Hi, I'm Jack Cush with Room Now. We're going to talk today about a case of joint pain, fever, and itchy eyes in a 30-year-old gal. She comes to see me September 27th. Actually, September 27th is when her symptoms started. She comes to see me in mid-January, almost 4 months later. Her story goes like this. She begins with sore throat, shaking chills on the first night. Then 2 nights later, she has a temp of 101, myalgias also starting with shaking chills. For the next several days, she has fevers that go up in the late afternoon, stay up throughout the evening, almost last throughout the night, but they tend to be gone by the morning. She says she gets night sweats at the end of all this. She was given penicillin, didn't seem to help things. She started having arthralgias, myalgias, shoulders, knees, ankles, hips. No swollen joints, however. She did have a rash on her arms, stomach, legs, and back. Later, it was on her face and her scalp, and then her eyes became itchy. She was admitted to the hospital about 2 weeks later. She was having midday fevers as high as 103, but usually about 102. She had a 5-pound weight loss. She had red eyes, conjunctivitis. She denied any history of hair loss, facial rash, photosensitivity, Raynaud's, diarrheic, swollen joints, or appreciable stiffness. In the hospital, her white count was very high, as was her sed rate, CRP, and ferritin. She was seronegative. On imaging, she was found to have hepatomegaly, not splenomegaly. She was seen by infectious diseases who found nothing and said this was an FUO, called a rheumatologist. Maybe they'll know. She was given 60 milligrams of prednisone and everything went away, and she was discharged home. She was weaning down on her prednisone throughout the month of October, and she was still having fevers up to about 101 in the afternoon. But by the end of the first week of November, the fevers went away, the rash went away, and she was doing well, only complaining of itchy, scratchy eyes. She was seen by the ophthalmologist and was diagnosed with uveitis and conjunctivitis. So when I'm seeing her now in January, she has been without any fever or rash or arthritis since second week of November. So no symptoms for 2 months. She only had symptoms, striking symptoms, for 6 weeks. On my exam, no rash. Her eyes were a little injected, but no excessive blinking. She had no lymphadenopathy, no hepatosplenomegaly, no evidence of serositis. She had 1 tender PIP, and that was about it. And the labs really were negative. But back in her first month of her illness, her AST was 49, her ALT 67, her white count was 19,000. She's a little bit anemic. Sed rate 57, CRP was 37 milligrams per deciliter, gigantic. She had a ferritin that went as high as 1,300. Her creatinine was normal, her LDH was normal, her albumin was also normal. She was B27 negative, quantiferon negative, urinalysis negative. Ultrasound of the abdomen showed she had hepatomegaly and some steatosis. No evidence of stones. She had some lymphadenopathy in the neck on CT. CT showed a pleural effusion and calcified hilar nodes thought to be consistent with old granulomatous disease. So I'm seeing her now again 4 months after the illness, and the illness was a 6-week history of FUO. In favor of Still's disease was the prodromal sore throat, fevers up to 103, arthralgias, myalgias, hepatomegaly, mild LFT elevations, and a small pleural effusion. The high white count, very high sed rate in CRP, ferritin was 1,300, and she had some mild weight loss. Those are all in favor. Against Still's disease was the duration of her fever and the magnitude of the fever. And there was no clear pattern to this, meaning while it was up and down, it sometimes stayed elevated, sometimes stayed a long time. This was not a circadian or truly quotidian fever. She had an urticarial rash on her face at some point. The lymphadenopathy was brief, but it was there. And she basically had a self-limiting course to her illness. The question is, Still's disease or not? I say no. Why? Because it was self-limiting. It was 6 weeks of illness. All impressive. If you told me this was her history and it wasn't 6 weeks, but it was 6 months, I'd say, yes, she has Still's disease. Don't ask me the very hard question of how long does it have to last to be Still's disease. 6 weeks or less, it's not Still's disease. 6 months or more, it's Still's disease. I always say when asked by patients, Doc, how long is this going to last? Meaning the systemic features, the onset features. I say, 8 months to 8 years, because less than that, I'm a lot less certain. And the Still's disease will abate in most people, and the patients will do well. Many patients will have long disease-free intervals, either 1 year, 2 years, as long as 40 years, in fact, is on the records. But some patients will have just one spike of illness and it'll go away. If it's 6 weeks or less, I don't know what that is. If it's 6 months or more, it's probably with Still's disease. But the thing about Still's disease, kids or adults, is it tends to recur. And there are long disease-free intervals. If it does recur, you cinch the diagnosis. If it doesn't, there's a little bit of cloud of suspicion at best. When you have atypical cases like this, when you don't know, either you do nothing and observe, or you can do genetic testing. If this patient continued to have symptoms, and in fact she is continuing with uveitis and conjunctivitis, now it is a little suspicious. Conjunctivitis is one of those common symptoms you see in many of the autoinflammatory conditions. It's seen in TRAPS, Muckle-Wells syndrome, FMF, Schnitzler syndrome, cyclic neutropenia. I think I could go on with a few more. And the point is, it's part of the constellation of inflammasome activation, and maybe she has an autoinflammatory syndrome. Uveitis, less common, but is seen in other conditions that either are autoinflammatory in nature or not. So I might get a genetic screen by, invitae.com, order an autoinflammatory panel, $100 to the patient. You get it out of the way, and now you know. Otherwise, you can observe the patient and see what happens. To date, the patients remained asymptomatic and did not have a genetic panel done. But this case, as presented, is currently no, not Still's. Hope you enjoyed it.